privilege to be here on Wurundjeri country on the banks of the Birrarung, where people have gathered for time immemorial to share stories about the past and to make plans for the future. Thank you, Uncle Tony, for making us so welcome. It's wonderful to see so many people from across the health system come together for this really important conversation. As Emily said, my name is Clara Gaff, and I've really been honoured to lead Melbourne Genomics Health Alliance since it was first formed in 2013. And Melbourne Genomics Victoria has been on quite the genomics journey since then. Some of you have walked each step of the way during that time, and others have joined along the way. Today is about establishing common ground to move forward from. So in that spirit, I'll just be clear about what we're talking about, because genomics is a word that gets thrown around a bit. It's been used in many different ways. I'm talking here about a technology that looks at many genes at once. That testing may find gene changes whose clinical impact is well understood, or it might find changes whose significance is not yet known. And we use the term genomic care a lot, because that's more than just the test itself. It includes identifying patients who may benefit from having this testing, helping them understand what the test might mean for them and their family, clinicians understanding the test results they receive and using them appropriately in the care of patients and families. It also means supporting patients and their family members through their journey and ensuring that all of this is done safely, effectively, and importantly, equitably. I think when you put it like that, you can see why genomic care can never be the sole responsibility of a laboratory or a specialist genetics service. It's the shared responsibility of all those providing care and those overseeing it. So genomic care has come a long way in Victoria, and I'm just going to talk about part of that story. So it's a story of thousands of people whom deserve acknowledgement and appreciation for the part that all have played. Some of them are here today to share their insights and expertise. Back in 2013, clinical genomic testing effectively didn't exist in Victorian healthcare. The human genome itself had only been fully sequenced 10 years before that. Genomics was still very much in the realm of research and really struggling to make that transition across into healthcare. There were no accredited laboratories, there are no laboratories accredited to do exome sequencing, for example. Fortunately, a group of leaders from Victorian hospitals, university and research institutes were able to envisage what this technology might mean for patients. They decided to pool their resources and expertise, forming Melbourne Genomics as a way for them to work together to bring genomics into healthcare. By 2015, Victoria had become the first place in the world to compare genomic testing with other health investigations in real time, real-world care, not only looking at the clinical benefits or patient benefits, but also the cost savings to the health system. That was possible because geneticists and doctors from other specialities worked together and shared their expertise, because laboratory scientists, bioinformaticians, software developers worked together to support one of the most complex tests in medicine. Because consumer advisors helped us at every step of the way to understand and address the issues patients face, and researchers meticulously gathered evidence along the way. So by 2020, we had the evidence base to show the difference genomics could make. But evidence is not enough to create the change needed to bring genomics into routine healthcare. It takes funding. Our studies informed federal health technology assessments, which proved the benefits for patients and the health system, resulting in an ever-growing number of Medicare-funded tests. It takes the right technology, so brilliant minds collaborated on a software platform that could manage genomic information within our health system. And it takes a workforce. More than 5,000 health professionals have been involved in Melbourne Genomics one way or another, and many more are now providing genomic care in Victoria. And now, Many of the pieces are in place for equitable care throughout Victoria. Many people in this room, and many more besides, have road-tested models to bring genomics into multiple medical specialities. Hospital leaders have determined what good governance looks like for genomics. Aboriginal healthcare leaders are talking with communities about how genomic care can be equitable and culturally safe. Doctors and educators have worked together to design world-class approaches to genomic education and professional development. So that sounds pretty good, yeah? Are you all ready to go forth do genomics? I suspect many of you will be saying, no, hell no, even. You're here today because you have important questions about how genomics can work within your hospitals, your workforce, your patient population, your budget and resources, which we know are stretched. Today, we're aiming to help start answering those questions. You'll hear from presenters and facilitators with a wealth of expertise to draw on. Just take a moment to reflect on this truth. People talk about healthcare as being slow to innovate and hard to change. But the story of genomic care in Victoria shows that incredible progress is possible. You've shown that you can do more than adapt to constraint. You can make innovation flourish and grow. You've delivered a change that has defied expectations in its impact and speed. Today, imagine the next steps that you can take with bright minds, shared expertise and systems thinking. So I want to thank the 10 members of the Melbourne Genomics Health Alliance for 12 years of equal financial, intellectual, strategic, forward-thinking and multidisciplinary collaboration. Phenomenal. I thank the Victorian Government, whose investment and backing has paved the way for Victorians to get world-leading genomics-informed healthcare. And I thank all of you here, the hospital leaders, the clinicians, scientists, researchers, policymakers and consumer advocates for the work you have done and the work you will continue to do together. Melbourne Genomics was a catalyst, the space through which you collaborated, and now our role is almost done. You don't need us to continue. The evidence is clear. The next chapter is waiting to be written. What it says is up to you.